Hi, everyone. Welcome back. I hope you've had as great a day as I have listening to the keynotes and panels and presentations that we've had to date. And I'm happy to be introducing the last formal session, our second panel of the afternoon. This one entitled Broader Data, Better Health, Exploring the Policy Impacts of Linking Social and Health Data. So whereas the last panel that Astrid moderated was about some of the research opportunities of linked data. Today, we're going to be talking about some of the policy impacts of linking social and health data. A reminder that the sessions are all being recorded and the video recordings will be available to you in about 24 hours or so. And that if you have questions, this panel is meant to be interactive and to generate lots of questions from you, the audience. So please remember to put them into the Q&A tab in the chat. So this panel session is going to build on the previous panel by exploring how integration, linkage, and analysis of data from across health and social domains can contribute to better government policy development and/or evaluation in Ontario. We've got a crackerjack panel assembled for you. I'm just going to briefly introduce each of the speakers, although their full bios are on the website, and feel free to look those over. Our first speaker is Dr. Fiona Kuyumjan, Associate Chief Medical Officer of Health and the Ontario Ministry of Health. Next up, we'll have Erica Wren, Chief Data Officer of the Immigration, Refugee and Citizenship Canada. Third will be Dr. Dirk Heyer, Chief Coroner, the Office of the Chief Coroner. Fourth is Dr. Michael Hilmer, Assistant Deputy Minister of the Ontario Ministry of Health. And then finally, Aklilu Tefera, Assistant Deputy Minister, Enterprise Data Stewardship Division, Ontario Ministry of Public and Business Service Delivery. So without further ado, I'm going to turn it over to the panelists. Each of them will have a few minutes to make some opening comments, and then we're going to open it up to Q&A. So Fiona, over to you.
Thanks so much, Michael. So I'm Fiona Kuyumjan. I am a public health physician and family physician, and very happy to be here on the panel today. I am here in my role in the Ministry of Health as an Associate Chief Medical Officer of Health, and we'll make a few comments about our work in public health and how we can use data on that integrate health and social data for various uses. So as many of you know, in public health, we work to improve the health of whole populations with a focus on reducing health inequities. So 3 specific uses we would have for integrated health and social data would be: first, to identify populations of interest; second, to understand health inequities; and third, to identify opportunities to intervene. And of course, these aren't mutually exclusive, but just wanted to split it up in a way that I hope is helpful framing. So first, to identify populations of interest, and we can also frame this as populations of concern, where we have a particular concern that we want to explore. We're often interested to look at the health status of a specific population based on either risk environments or known equity considerations. And as an example of this, during the COVID-19 pandemic, we had a lot of challenges in identifying data for people living in certain congregate living settings. For example, people who are in shelters or people who are in correctional facilities. And of course, this made it difficult to understand the burden of disease and also to be able to understand the state of certain prevention strategies. And a particular example would be the coverage for COVID-19 vaccination. Of course, these data would be valuable to be able to understand levels of risk, but also to inform the delivery of appropriate prevention strategies. The second broad use is to be able to understand the inequitable burden of disease. We're interested to advance cases for evidence-informed social and structural interventions, and in order to do this, we need data on health outcomes for specific sociodemographic groups. And often we rely on neighborhood-level characteristics, but of course, neighborhood-level data do not replace individual-level data. So examples of where this might be of use in our current context would be knowing more about the sociodemographic characteristics of people who are affected by recent emerging or re-emerging infections, such as Mpox or syphilis, or looking at how mortality is differential by sociodemographic group. And certainly that was of interest during the COVID-19 pandemic. Third, we're interested to identify opportunities to intervene to prevent adverse events and to promote health. We often look at data on interactions with healthcare to identify opportunities to intervene, but it would also be valuable to have additional data on interactions with other services. As an example, for people who experience drug toxicity events, we'll often look at events like encounters with primary care or emergency departments, but it would also be valuable to be able to look at encounters with social services or with police and corrections, which might point to interactions where we could implement prevention strategies and support access to primary prevention, treatment, and social services. I want to conclude by saying we're delighted to see the progress at ICES in integrating social and health data and look forward to opportunities to advance population health, including through health surveillance, research, and evaluation work. Thank you.
I think it's my turn to take the stage. So, hi everyone. My name is Erica Wren, and I am the Chief Data Officer for Immigration, Refugee, and Citizenship Canada. So it's really, I wanted to thank, first of all, for the organizer for the invitation, and I really feel privileged to be speaking to you on a topic that really lies at the heart of immigration policy and public health. And it's really the unique and indispensable role of our department, Immigration, Refugee, and Citizenship Canada, as a provider of immigration data, and also as a consumer of public data that can help us to make better policy decisions. So I think there's no dispute that in a world where data-driven decisions is really paramount, I think that our data, our IRCC's data, plays an essential role to serve as the foundation upon which our policies are built, including in the realm of health, infrastructure, and housing, and others. So I wanted to maybe take a moment and consider the latest population estimate for Canada in 2023, which was published by StatsCan just a few weeks before. So Canada, us as a country, we had just surpassed 40 million residents for the first time. Now this growth is mainly fueled by a surge in permanent and temporary immigration, which accounted for the majority of the increase in our population. Now the fact really highlights the crucial role that Immigration, Refugees, and Citizenship Canada plays in steering Canada's immigration landscape and drawing extensively from its vast administrative data holdings. Now, this data isn't just for us to do our paperwork or processing applications. I think it's a major force in driving our country's economic and social progress and prosperity. Now, recognizing the imperative and effective program administration and immigration planning, we really understand the importance of embracing a very comprehensive and whole of government approach to setting immigration policies. So maybe let me just take a step back and talk about how IRCC really has been instrumental in facilitating immigration, and in that process, building a very extensive, a massive data holdings. So since our department was established in 1994, we really have been at the forefront of initiatives to welcome immigrants, whether it's supporting refugees or offering really important services to assist newcomers in integrating across Canada. We often are the face of Canada to many, many newcomers. In addition to that, recently, IRCC's responsibilities also include granting citizenship and also providing essential travel documents to Canadians, such as a passport. So these essential functions have really contributed to, I would say, the growth and accumulation of our comprehensive data holdings by IRCC. If a person has come to Canada, we have data on you. So I think that provides us a very unique position and opportunity in offering invaluable socio-demographic insights into the immigrant population and what Canada is made of. So maybe let me just pivot a little bit to a very key aspect of IRCC's mission, in addition to fulfilling our department's mandate, and that's to leverage our wealth of data resources to make informed decisions and enhance program management not just for a department, but really across different levels of government. This holistic approach really requires integrating diverse data sets, collaboration, and enabling that kind of collaboration and information sharing across governmental domains, really fully understand the wide-ranging impacts of immigration policies and programs. So I think at the forefront of this effort is my role as the Chief Data Officer, and I am supported by my fantastic team from the Research and Data Branch, where we actively repurpose administrative data through strategic collaborations with provinces, territories, and sometimes our international partners. So these partnerships, in my mind, not only enhance our data assets, but also help to drive research initiatives and form evidence-based policy decisions across Canada at all levels of government. And I think an excellent demonstration of our commitment to data-driven policymaking is our collaboration with provincial data organizations. So I think many of you are aware that IRCC's data is intricately linked not only with Ontario's health data, but also with British Columbia, Manitoba, and Brunswick. And these 4 data linkages really cover about 75% of the immigration population. And we look to further this kind of collaboration with other provinces, for example, Quebec's health data. That's being facilitated by the Institut de la Statistique du Québec, and also to integrate with our immigration data by providing coverage for almost over 90% of all immigrants admitted to Canada. So why is this so important? And I think an excellent example of putting our data to use is really how Canada is addressing public health challenges, in particular highlighted by the role of data in navigating the impact of COVID-19 pandemic in the past few years. So we've done some very detailed analysis of demographic factors, such as socioeconomic indicators and health outcomes. And through that kind of data sharing collaboration, Ontario health agencies really gain that kind of important insight into the pandemic's different effects on the immigration, on immigrant communities. So I think as we look forward to the future, the significance of IRCC's role in shaping Canada's landscape really becomes even more increasingly apparent. In my world, continued investment on data infrastructure, research, and collaborations will be absolutely essential in addressing emerging challenges and also seizing opportunities. So our commitment to leveraging high-quality data and evidence-based research becomes even more vital for steering Canada's immigration policies and programs towards a more sustainable growth, inclusive prosperity. At the foundation of our immigration strategies, our provision of immigration data is really important, and I think it's indispensable. And through very strong partnerships and collective support, such as partners like yourselves, I think we really have a very bright path forward. And in its use to leverage data's power to inform, empower, and really transform lives. And I'm really looking forward to what's the next chapter to come. Thank you.
Good afternoon, everybody. I want to thank Michael and ICES for the invitation and for carrying this conversation forward. It's, I think, so important, so integral to helping to think about how can we help inform health interventions and prevention. Of course, I'm the chief coroner, so I, of course, bring mortality data to the table and recognized it's clearly impactful as a serious and meaningful outcome. The question is it the outcome, or is it a unique circumstance? And so I'll talk a little bit about that as we go forward. But recognizing the importance of our information and the information that we learn from those that suffer tragic losses, and how can it impact the health and safety of Ontarians, we've looked at trying to ensure that we obtain the best possible information to be able to inform others who may be in the role of intervention or prevention, or in fact in the role of understanding that data in a more effective way. We've also built in our own organization expertise of understanding the the mortality data in the data analytics for safety and health unit that has data smart people, have epidemiologists and led by Matthew Hodge, who has specific expertise in public health, clinical care, as well as data analysis and understanding. So when we looked at the work that we've done, we instituted a new information management system through an IT process that both helps the coroners do their work, but also as a data capture tool. We tried to build mechanisms to be able to collect information that would help those in their own specific areas to be able to inform prevention and intervention. And so taking an example of those that would have the most knowledge, such as Life Saving Society, what do they want to know about drowning deaths? What's the information that we should collect to understand the patterns from before, but also thinking about how do we inform the work that they're doing? And we recognize that we need to have a consistent and robust and aggregatable data set. And a good example that many of you know about or have heard about, and Fiona touched on, is the substance mortality data set. And by having that robust data set, hopefully will help with recognition of patterns, trends, issues that then can inform changes from a policy point of view, but also at a practical level where there are organizations that are responsible for intervening or taking next steps. So what are the challenges with our data? Well, the question is it complete? And the challenge, of course, and sadly, because of the tragic loss, we can't ask the person. The person isn't able to tell us, for example, things such like race, identity, disability, those types of things that are very personal and very much known to the person and not necessarily known by everybody that's around. So that's a first issue. The second issue is, do the coroners know what to ask? And would they ask as broadly? Their job's to investigate the death, understand the circumstances, and it may not be that those pieces of information would be felt to be relevant at that particular time to ask the family or to make further inquiries. And Fiona touched on subsets of subpopulations where there is greater risk, greater potential for harm, marginalization, such as corrections, for example. So we have a specific question around corrections, but it's a difficult thing, and sometimes people don't know to ask or know the answer. And so if we could link that with the provincial data set, such as that corrections have in the Solicitor General, then that would be a source of truth for us and would make us have an easier way to know for sure that we have a robust data set around those. And so that's an example of where we could link to enhance the data as far as accuracy and completeness. The other issue, of course, is how can we better understand the mortality trends, the mortality data, and linking to other data sets that would allow us to understand the trajectory of that person's life to their death. And so linking with other data sets would be of great assistance, again, because the coroner can't ask all of those questions, and we know that there are data sets that are available, especially health systems data sets. So looking at an example for suicides. So understanding what happened over the period of time before that person died, and that would allow us to understand any unique issues or trends or patterns or challenges that occurred from a systemic level along, if we looked at all those suicide groups together from the mortality perspective. But then also, if we compare the findings or the trends that occur within the suicide group, can we do that comparison to those who are in a morbidity situation, so those who had attempted suicide or other similar subgroups, to be able to have an understanding if in fact there is specific features within the group that died from suicide to those who are not, again, to inform prevention, intervention, and really take on an opportunity to really hopefully make things better. Same thing with substance mortality versus morbidity, really understanding what's going on. Briefly, some of the difficulties that we've had is access and linkage from a technology point of view. access and linkage from other legislation that may impact our ability. We have the ability to learn everything or access everything, including personal health information about deceased persons, but having that and how do we access it and how do we get through it can be challenging. There are at times privacy concerns that are articulated, and sometimes we have the ability to facilitate linkage, but utilizing another organization and trying to have that information come back to us in a linked format is not able to be done. So it doesn't allow us to do some other sub-analysis. I think also important to recognize when we're looking at and thinking about race and identity, thinking about the communities that may be impacted by that collection, thinking about the communities about how it is their information and their data. For example, First Nations, Inuit, and Métis. How do we govern that? How do we have stewardship? How do we recognize the OCAP principles in working through with that information? So all of us are working together. All of us are working to overcome within having the goal and the perspective of hearing the voices from those that have passed to help us to prevent further deaths. So there's lots of work to do. There's lots of great work happening, and I'm thrilled to be here with everybody and my colleagues, each of whom we're working together to try to make a difference. Thank you.
Good afternoon. Michael Hilmer here. Pleasure to be here. Thank you, Michael Schul, for the invitation, and indeed to ICES for hosting this event. I think it's fitting that I've got so many great colleagues here from Ontario and federally, particularly the ones from Ontario who I've collaborated with on different projects to integrate information to bring insights. And so I thought I'd hit on a few points. My role is twofold. I oversee the digital health portfolio, which is all about integrating clinical information so that clinicians and patients can make the best possible decision in the right amount of time, and then to bring policy insights to my colleagues using administrative clinical data, integrating it together and meeting their needs, whether it's from a perspective of generating new policies all the way to evaluating policies. So I thought I'd start with my digital health responsibility and the imperative to integrate clinical information with population health information and social information. So if we think about integrated care, which I think every health jurisdiction is chasing that goal of truly integrated care centered around the patient. It takes different forms. You can have integrated national systems in different countries, or you can have different integrated care systems within organizations, the Accountable Care Organization in the US, or groups like Kaiser Permanente, or in Ontario, we are pursuing a model of integration called the Ontario Health Team. And the Ontario Health Teams will seek to integrate care to make transition seamless and care as effective as possible. And one of my passions and pursuits is to ensure that the Ontario Health Teams have access to population health information. And that's not just for planning purposes, which is incredibly important. This is for care purposes. And we do this in Ontario now in specific limited circumstances, specifically for cancer. For those of you who've turned 50, you would have received a colon cancer check. So there's special legislation that allows Ontario Health to look into the admin data and write letters to you, and that is a form of population health. And what I'd like to be able to do, and anybody who is involved in integrated care, is be able to coalesce all the information about the population, and you stratify that population by different variables of risk, and then you engage with those individuals within those cohorts and hopefully attach them to good advice, to a model of care, to some sort of care process. And you could imagine people with chronic disease or people eligible for a particular service that only becomes apparent when information from disparate sources are brought together. And this would only get richer and richer if information from social scenarios was brought into the fold as well. And so this requires, building on Dirk's comments, both a technology to be able to bring the data together and have the right people see the information who are authorized, and then to be able to aggregate that up to population levels. And it also requires a strong legislative framework, so ensuring that it's adherent to PHIPA here in Ontario. So that's the use case for digital health related to integrated care. And I'll move my comments now to big populations of data. And so my area collaborates extensively with the Ministry of Health and the Ministry of Long-Term Care on horizontal planning and evaluation exercises. And Fiona is here, which is great. We collaborate with the Chief Medical Officer of Health Office all the time. And a couple specific examples where we bring information together either at the person level or the ecological level. We make extensive use of geomapping. This is a really powerful technique where you can understand where to place new services and calculate things like drive time and understand neighborhood characteristics, both as they relate to things like number of newcomers to Canada, languages spoken, but also what other services are available. So that kind of integration geographically is incredibly powerful. And then we look at the nexus of long-term care and home care and community care services all the time to try and understand who might be receiving home care, who could become soon eligible for long-term care, and then what characteristics of that individual might be important for placement. Again, that's languages spoken or a desire for a particular type of culturally appropriate home. And then again, building in that social layer just brings an additional richness and personalization to the kinds of analysis we can bring. I think, again, using a small pandemic example, our ability to go from highly aggregated population data sets, generating insights from those, all the way down to individual postal codes and generating insights from those has become so much more pervasive and sophisticated, and we'll just do that increasingly more. So the unit of analysis is no longer really all that limited when we can go right down to a postal code. And then I'll end just by saying true integration, at least in Ontario, does require legislative authority. And several years ago, working very closely with ACCI, we built in new parameters to our Freedom of Information legislation, FIPA, that allows ministries to bring data together from across the social services. Previously, this was incredibly difficult to do. And working closely with the Information Privacy Commissioner, we drafted, in Ministry of Health's case, parameters that were endorsed by the IPC that allow us to bring data together from different ministries, aggregated at a record level, and do meritorious projects with it. And I know Michael and ICS are pursuing the extra ministerial data integration unit status, which would allow them to do it outside of government. So really, integration of data, I think, starts with great relationships and then great important policy problems. Technology is incredibly important, and it all has to be on the bedrock of authorized legislation that give the trust back to the people that these activities are happening under the auspices of scrutinized procedures and transparency of action. So I'll end there and pass it along to my next colleague.
Hi, good afternoon. My name is Aki Tafarra. I'm the Assistant Deputy Minister of a newly formed enterprise capacity here in Government Ontario, Enterprise Data Stewardship Division. I'm just new in that role. As Michael said, I've been in social services for many years, and I just will talk a little bit about that as I talk for the next 4 minutes. I just wanted to start by saying that we are entering into a very exciting new chapter in data integration, and I think Ontario, I believe, has taken a unique model for data integration, building capabilities both inside government and at the same time externally, which is ICES. There are 3 interministerial data integration units that we formed, just basically based on the kind of work that we did, Michael mentioned a minute ago. 2 are already activated. One of them is with Ministry of Health, and the other one is with our colleagues at Ministry of Community and Children and Social Services, MCCSS, and the third one will be activated soon at Ministry of Finance. I think designating Institute of Clinical Evaluative Sciences as an external interministerial data integration unit is particularly important because it will accelerate, advance our ambition to use and reuse administrative data to advance public policy priorities. ICES's designation is built on kind of like over a decade of experience. If you were online earlier, Yona talked about a project she led called Healthcare Access Research for People with Developmental Disability. That began just over 10 years ago, and then it was a good test case for how we can integrate social services data with health system data, and not just only integrate it, but then use it as a kind of collaborative joint research program, and I call it research program, to advance a specific objectives, public policy objectives for persons with developmental disability. I think it was a really unique research program that demonstrates real impact, real value for public policy decisions, program designs, interventions both at the health service system and also a development service system. So that in my mind was the catalyst for kind of us to advance the relationship with ICES. And then I can also mention another example that we used that partnership and that data. There was a project titled Converge 3 that looked at the health, economic, and equity outcomes that was led from University of Toronto, and both Michael and myself were on that at that table, supporting the governance process. And that also helped us deliver on a whole lot of different public policy ideas, as well as gotten into more of an economic and equity analysis when it comes to health services, particularly looking at cost benefit and of investments, and how do we really evaluate the investment priorities. So that was just another example. And lastly, I'll mention, I think it's been mentioned so many times today, the pandemic. The relationship we had with ICES was instrumental in addressing some of the high-risk populations when it comes to immunization. So one of the things that we did there was look at the social assistance caseload data linked with immunization data and identify the immunization rate for different populations, subpopulation, and work with our service providers as well as public health units to directly intervene in those communities in a different way. So to me, I think this partnership, this relationship is great. And then we are entering into this new exciting space. We all know about the benefits of integrated administrative data. It is fast, it is quick. We can use it to undertake policy evaluation, assess the impact of some interventions. We can run a randomized controlled trial or quasi-experiment kind of models quicker than using different type of models. So we're just so excited about this new chapter, and to support and accelerate that, we've created an enterprise data stewardship division here that will work very closely with all these data integration units that I mentioned earlier, and support on prioritizing key public policy priorities, service delivery priorities, and drive that agenda. Some of the things we're currently grappling on include, like, how do we use this capability to advance policy priority for government? How do we use it to improve services, both at health, social, and human services area? What population-based metrics can we design and develop together to advance and a report on progress, to advance our policy agenda and report on progress? And how can we tell a better story, especially when we make investments, or when we want to make investments or investment choices? How do we use this data to tell the story around return on investment, both immediate service outcomes as well as long-term impact of interventions? I think when I think about this capability, we need to really be very careful. I know researchers earlier were talking about the fact that they've advantage because they have ethics and so on, but we want to make this more of a government and researchers partnership. So how do we really acquire a real social license to operate in this data space? How do we govern the whole entire capability? How do we engage public and communities? And how do we ensure that we have equity, fairness, and transparency built into all the things that we do in this space, and particularly look into data sovereignty issues with our indigenous partners. So all these things would come in more and more as we continue to tackle these public policy issues using very rich integrated Ontario government data with other health data. So that's basically where I stand. Sorry, I'll end it here and I'll pass it on to.
Okay, thank you, Aki. That was terrific. Well, thank you to all the panelists. All of you had great comments, and Aki, I think you rounded them out very well at the end. So we're now going to go into sort of the open round, if you will. So I guess we'll bring up all the speakers onto the screen, and I'll invite you to put your questions into the Q&A tab. I see there's one there already, and please add to those questions. To get things started off, I'll ask the first question here, and I just want to note that Michael Hilmer let us know he has to drop off at 3:45. So if Michael disappears, he's not upset with us. He just has to go see the minister or something. So anyway, all right. So first question to the panel. I mean, all of us are here on this panel because we're all kind of data geeks. We all love data. We think data is really important, but we also know we're talking here about how policy are set, policy priorities are made. And we know that governments do that on the basis of a whole combination of factors. They might be economic factors, social factors, ideological and political considerations as well. So how can we collectively, how can we be more effective about ensuring that data and analytics are actually becoming a more important factor, or at least, let's say, at least as an important factor in the decision making as those other things when it comes to the people who ultimately have to sign off on policy?
Yeah, maybe I could offer just a few comments, and then I will need to depart. But I think it's a great question, and I think the first thing is that we need to make sure that we remain nimble and agile, and I think that's why partnering, with you, Michael, and your organization is always great, because you are an applied research organization, and the vast majority of your researchers have positions themselves in organizations, either as clinicians or decision support type units within hospitals or otherwise. So first is just understanding that political context, I think, is really important. That sometimes decisions need to get really made very, very quickly, and at that point, providing the best of what's possible in the time you have is the best contribution you can make. And in order to do that, having granular available data, understanding of who's required to interrogate it, who are the best scholars and clinicians that can bring some insight to it, and then having the tools to give it back to whoever's requesting it, me, Aki, Dirk, Fiona, Erica, and then from that, trust builds up, and it's a virtuous cycle. So I would just say that, again, it's you need to have the data that's responsive. You have to be comfortable that imperfect is going to sometimes be the best that you can do, and that's better than nothing. And that the more you're able to address the question head on, the better, which I think speaks to our integration need. And then the final thing is, be willing to move out on a limb where maybe your wisdom is telling you something about the data that maybe the data itself doesn't tell, but your experience, your wisdom, because I think we crave that. We go to you not just for your data expertise, but your understanding of the system, and that's incredibly valuable to us as well. So I think that all just leads again to this lovely virtuous cycle that builds a strong foundation that we can generate lots of great insights from.
Does anybody else want to take a stab at that? Thank you, Michael.
Can I just jump in?
Go ahead.
Sure. I think you mentioned ideology and other political imperatives, but I think to me, a lot of those are done because there is quite a bit of evidence vacuum, if I may say so. So I think building a lot of these evidences and data points, as long as they are the story is strong, that it is about to improve. It's about improving outcomes for Ontarians, for the public. I think that to me goes a long way. So that's the first thing I want to say. But sometimes it's so hard. And I agree with Michael on that sometimes we'd have to really accept imperfect data and then a quick turnaround, because sometimes different people made pretty fast. But I think the longer the partnerships and the longer this research, and then the better relationship between government and the researchers facilitated through this data and this capacity, I think we would have a better evidence to inform decision making, and to me, I think to drive data driven or to drive decisions through data. So that's kind of how I see it. So it's just about being ready and then building the evidence for sometimes unknown quick turnarounds from government perspective, because public policies don't really sit and wait for researchers to design a research and get results over months and years sometimes.
Okay, thank you, Aki. Does anybody else want to add on to what Michael and Aki have said?
If I can just add a couple things. I think there's many challenges in terms of using data, just-in-time data and accurate data, and making all of these very interesting linkages across all levels of government. There could be 1,000 priorities that we're running chase after. For me, I think it will help us to bring some kind of cohesive prioritization of what's really best for Canada and what's really best to ensure that the health needs of Ontarians, of Canadians, are taken care of. So for us, from an immigration perspective, we look at the linking of immigration population data with health data as an absolute win for all of us, because having that kind of integration, it allows us an opportunity to really examine the socioeconomic indicators. For example, whether it's employment rates or housing stability, or immigration policy makers can really start developing these targeted programs and address barriers to integrate our newcomers, because we all saw Canada's population growth in part has really been driven by immigration. And so the integration analysis data from the healthcare and social domains really helps us to provision and set our immigration policy and future targets better. So for us, it's an absolute must. And I think just to identify those priority areas where we collectively towards the prosperity of Canada is really important. And that kind of strategic partnership is exactly the kind of conversation we need to have among ourselves.
Okay, terrific. Unless any other panelists want to say something on that question, I'll move to the Q&A. Okay, so I'm just going to, we have a bunch of questions in the Q&A. I'm just going to sort of pick some that I think we haven't really covered off yet. This one is asking to hear about any quick wins the panelists have experienced with the integration of data and how that's translated into better care.
I'd be happy to start, Michael. So it's Dirk Heyer for LRM Centered. So we brought our opioid-related mortality data to Michael's team in health, and we integrated that data, linked that data and integrated it, and did an analysis to see what the health system use was prior to a tragic death from opioids, and recognized a significant number of intersections with the healthcare system before, and we were able to quickly take that information to those who are in the healthcare provision field, for example, TASM, the Toronto Academic Health Sciences Network, and they then moved forward with thinking about how can they improve or change or enhance their own individual responses at the hospital level. We saw some great success with further development of RAND clinics, further development of consultation in addiction medicine, and approaches towards the care of people who present with opioid toxicity to the emergency department. So that there's a concrete example of linkage and integration, bringing our data into with health and finding some great success from that.
Terrific, thanks, Dirk. Anyone else want to give an example?
I can jump in,
Sure.
And then I think I mentioned a bit earlier around the pandemic, because I think it was really, we don't call it research. This is usually through the applied health research questions. These are like fast response that we get through the conversation we have with Michael and support Michael's team, ICES team. A couple of areas that we leverage the integrated data there. One is around driving immunization uptake for social assistance recipients. That was really critical work. It was quick because it was built on already partnership. I think we were able to quickly identify where we were seeing gaps and how we were able to drive immunization through public health units conversation. That's one. And the second one is there was a concern around the lockdown that there was quite an uptick or an increase in violence, especially maltreatment of kids and families and gender-based violence. And we did a quick work on that one as well to get some data through the ER data that is sitting in at health and looking at it from the perspective of the impact of the pandemic on potential domestic violence, for example, and inform some interesting public policy discussions or intervention discussions in government. So I just wanted to mention those two great examples.
Great, thank you, Aki. Fiona or Erica, do you want to add to that?
I mean, I can just say that, like when I read the term quick wins and I think about all the work that goes into setting up data integration, it's substantial, right? In terms of the, thinking about data governance, all the technical work, the, data sharing, data cleaning. And I think that, the example that you just gave, Aki, is a good one. Well, the first one in particular, because the best time to set up the data integration is before you need it, and to really have a foundation in place so that when we do need data, often in the context of urgency, whether an actual crisis situation or a political opportunity, it's really valuable to be able to access the information that we need in a timely fashion. So yeah, just recognize all the work that goes into setting up these data, these integrated data systems, and yeah.
So quick wins occur on the foundation of hard work and long work, right? Erica, any thoughts?
Yeah, I think, quick wins, probably some people will kind of look at quick wins as something that's relatively low effort and can be done quickly. And that may be the case where pull all of our resources together to tackle something like a pandemic, which we have done, looking at how fast services were provisioned for Canadians. But to me, it's not necessarily having that kind of quick wins, but really sequence an effort towards what is the most urgent and what is most important for our collective priorities. So, and an example of that, given that example of the pandemic, it's perhaps disproportionate effect on certain vulnerable communities in the immigration realm. And I think that's a good example of us at the federal government level using that kind of assessment data to say you have been affected by the pandemic in that particular way. How can we refine our, whether it's settlement services or grants and contributions to support our local partners in helping this more vulnerable population in getting over that hump, getting over that challenge. So I think that's a very distinct and very specific use case of data integration, where it's, there's a process in collecting the data and integrating data and immediately being reflected in how we tailor our programs in that settlement and contribution kind of space. Many others examples come to mind, but nothing in data when it comes to integration can be quick. In a way, when it's quick, it usually means there's lots of effort and years of effort that's putting into to ensure that quick integration and quick win can happen. So it's always going to be a continuous improvement journey.
Great. Okay. All right. Here's a good question. A bit of a change in gears, but I think interesting, especially for those of us who like to work with data. Given all of this effort in data integration and opportunities for new types of analyses, do you foresee investments in modernizing and improving the quality of data sets which really weren't designed for research, surveillance, or evaluation in the first place? Who wants to take a first stab at that? Aki, in your new role.
I'll jump in. Yeah, I'll jump in here. Yeah, thanks, Mike. So this is a great question. When we talk about using or reusing administrative data, we're just talking about data that's collected primarily for a different purpose and repurposing it for research and or other evidence development, right? So usually what we know from that exercise is the fact that the data would have gaps, completeness issues, data quality, and so on and so on, right? So I think what we need to really think about is how do we really improve that data asset as we go forward, and how do we make it stronger? Particularly now when we think about big data and in using new technology and advancing and accelerating best service offerings to the public, how do we then use that data to improve? So what kind of feedback mechanism do we need to bring in from the researchers, from other data geeks and data users, as you said, Michael, back into the program policy design team, the data stewards, and then start improving the data quality? Now, there are different type of methods, and the researchers out there do really great job in synthesis, creating synthetic data and imputing data and making sure that it is good for analysis and evaluation. But if you want to do this in a better way, then what can we really bring back at the look back process to collecting better data, improving data quality at the collection point in order to accelerate the value, reduce the effort after the fact, and then improve the impact of the work that we do collectively. So that's kind of how I'm thinking about it, and that's one of the piece that I'll take on in my new role in government as we continue to advance this work. Yeah.
Any other thoughts?
Sure, I'll jump in for a minute. I think building off what Aki's saying, I think it's important that we don't get, and I'm not suggesting the question's saying this, but important we don't get paralyzed by trying to think about how to get the best data sets, because we're really not going to be able to predict what we need, how we need it, and where we need something maybe in 5 years. So we have to, I think, do both. And I would suggest we have so much data and so many data sets now, doing what Aki's talking about, which is not my expertise, which is working with those data sets, bringing the perspective and the smarts and the skill to being able to think about how those data sets can be worthwhile. We were involved in a project that really brought all kinds of administrative data sets together, and really so disparate in the way that they were built, to the point that they were basically very challenging to use, which gave us lots of learning. But if we really wanted to drill down, we could probably use those in a very effective way. So I think it's having the two thoughts together, but not getting stopped on it's not the best data set.
Maybe I'll jump in a little bit and just add to what's already been discussed. I think in today's world, we have so much data, whether it's human generated by collecting something through an application for Passport, or machine generated. We all have smart devices to generate data that we don't even see. So I think we need to protect ourselves a little bit in having that kind of stock take, understanding the type of data we have, for which purpose it's collected or generated, for which purpose it's meant to be used, and also having an understanding of the level of confidence which data that we base our decisions on. So at IRCC, we have implemented a data quality assessment framework, and we're using that to assess billions and billions of rows of data that's based on decades of immigration data in order for us to gauge that kind of comfort. Yes, we want to provision a program based on existing data, but if the data is all wrong, you're only as good as your weakest link when it comes to policy making. So having that kind of awareness of knowing this is good data, we could use it, or this is good enough data, we could use it with a degree of caution, is also really important. And that needs to be a continuous feedback loop. We've identified this as good data. What does it make good data? Continuous collection, provisioning is an example. Having that automated built-in check, automate that kind of validation at data collection is another example. So having that kind of continuous improvement loop built in any system that we create to ensure that data quality is only going to improve is really key in any data system investment going forward.
Thank you, Erica.
Can I just make a quick comment, Michael? I'm just thinking, on a practical note, I mean, the question is about investment. And so, of course, within government, when we want to make changes to data collection and data systems, we need to make a case to justify the spending. And so I would just say, if you're encountering fundamental challenges so that you can't answer questions that are important to be able to understand, improve the healthcare system, understand the health of Ontarians, let us know, and we can add that to our cases. We constantly need to justify investment in data. So yeah, great for you to share it with colleagues, but also great for you to share it with us within government too.
Great. We really just have about like a minute or two left. So maybe I'll just paraphrase one question that's in the chat, and if any of you want to comment on it, please do. And the question was around public engagement and the discussion that there's been public engagement by various bodies, some academic, some within government and so on, to talk to the public about this kind of work, about using data in this way. Do you think we need to do more? I mean, do you think we've done enough and we've got the answer from the public? Do you think we need to do more? Do you think does it need to be an ongoing process? What are your thoughts on that? And I'll just throw it out to whoever wants to answer that.
Yeah, we definitely need to do that, Michael. Aki here. I talked about social license to operate in this space. I think the researchers might have it. Like, we need to really engage with the public. We need to make sure that we're transparent in what we're doing. We need to actually focus on public policy issues that are relevant for the public good. We need to drive this more from the equity, fairness, and transparency perspective. So to me, I think as we continue to advance this work, there is a real need for us to continue to engage with communities and partners across the province and in the nation.
Anyone else want to add to Aki's thoughts?
I absolutely agree. And I think we also need to walk the talk, which is people are asking us for the data, the public are asking us for the data. We need to provide the data in a way that's understandable, a way that people can grasp and digest, and also to help people to understand where that data came from and how do we have these data, and how do we why are we using it. So I think it goes to openness, transparency, reflection, and recognition of how it could be helpful, but also recognizing how it could be harmful, and thinking about how do we put ourselves into a position to think about that potential harm, and therefore address that in advance or in a way that would reduce any potential harm or eliminate that. So I think all of those things are important to continue to build the credibility of these data, but also build the credibility to why we should be doing this.
Okay, Erica, last word to you.
Yeah, transparency and openness. I mean, data, what we do is for the public. So what we do with the public's data should be transparent. So it's no, secret that Canada, the government of Canada has an open government, Canada's open government implementation plan. And we recently just renewed that commitment in terms of offering Canadians a more transparent and more engaging, more open way of having that dialogue with different Canadian federal institutions. So I encourage folks to take a look at immigration data that's published on the Open Data Portal. We have hundreds of data sets. But I think it's equally, I think someone made that really important note. It's important to put the data out there, but it's also really important to educate the public on what that data should or should not be used for. Data comes with its own limitations. So not explaining that, not providing that kind of context could introduce potential harm as well. But absolutely transparency, openness, that's the first principle to being a good public service steward.
All right. Well, listen, thank you all so much. We're out of time. That was a terrific panel, a great way to close out what's been a fantastic research forum today. So Dirk, Erica, Aki, Michael, Fiona, thank you so much for participating in the panel today. And we look forward to working with you in the coming months and years. Okay, so as my phone goes off, let me just try to turn that off. There we are. Okay, well, listen, thank you to all the speakers from our afternoon keynotes and the whole day, as well as the plenary, the presentations, the spotlight sessions, and so on. I thought it was a terrific day. I got a lot out of it. I heard conversations that were stimulating and took me down new paths, and I hope you did too. I'm very eager that the conversations that have been started today will continue in the coming weeks and months as we find ways to work together with many of the partners that are represented here today in the conference. And ultimately, this is a journey of improving health, improving healthcare, improving health policy, and we know that that's not going to end anytime soon. So this is a wrap for the formal content of our day and brings us to the close of the 2024 ICS Research Forum. It's been great. It's been fantastic. I really want to thank, from the bottom of my heart, all the presenters and moderators who made such a terrific contribution. I also want to thank our communications team at ICS who organized and run the forum. Kim, Misty, Anu, Zanetta, Charlotte, thank you so much for everything that you've done in the months leading up to this and today. And also finally to all of you who attended, to all of you who asked questions and were engaged and are going to continue to be engaged even after today. We so appreciate your time, your attention, and your involvement in this event today. I'll repeat also my thanks to our sponsors, the Ontario Ministry of Health and the Ontario Sports Support Unit, whose funding helped make today happen. A final reminder that a recording of the forum and the presentations will be available on our website the next couple of weeks. We're adding a link in the chat right now with an evaluation form, and we'd appreciate hearing from you your feedback about the forum today and how we can make it even better. This will help us make for an even more engaging forum next year in 2025. And as soon as we can, we'll have the date out to you so you can get that into your calendar and mark that day so you can participate again. And with that, we will close now by asking Elder Wendy Phillips, who so graciously opened our day, to help us end the day with a closing prayer. Over to you, Wendy.
Great. Thank you, Michael. Oh, bonjour. Magazi dodem. Widow casa bashkot and dejankaz was oxing na donji. Ki wain sibin and donjaba. Jaman make parwad mean dow. Chimi gwach kenage go gajak told. Chimi gwach minimum manzawin. Chimi gwach dwagan dwaganak. Pogan poganak sheshkan sheshnak. Torkamak. Chimi gwach boaman boamnak. Chimi gwach dodem dodamak. At this time, we give our acknowledgments to a being that has created all things. And this is, for us, we provide our gratitude to what we describe as a good way of life. And for us as Ojibwe people, that this is a very important concept. So for us, this is our traditional territory, as we are one of the largest nations here in Canada, and then we're probably maybe the third largest nation in North America. So for us, our nation, includes many other dialect families within our nation. So this is for us when we talk about our worldview, our culture, that there's not a religion as we may see other nations may describe. For us, we have many concepts, many principles, many laws, and so we describe Minabamadzawin as a good way of life. And so for us, there's ways of knowing and ways of being, and we hope that when people can understand these concepts and these belief systems, and that they will align themselves within creation. And so this is for us, when we talk about to be in balance with creation, that this is what we strive to do. And so the outcome, that a lot of us describe is peace. That when we talk about when you can achieve those things, that you truly have, that enlightenment that, many people, desire. And so this is for us, what we hope, and, what we try to encourage people, to get to that point and understanding, our way of life. So this is for us very important when we talk about today, that for us, this is, I think, one of the beautiful things about data, and about research and collecting data, that for our people, we have done that for thousands of years. And this is, I think, one of the beautiful things, for one of our belief systems, that our elders always used to talk about, is that the universal language would be mathematics. And that is one of the best ways to establish communication with one another. And so that's something that we've often acknowledged, and the way we transfer knowledge, the different methodologies we use, were ways to also track our data. And so this is the importance of our birch bark scrolls and understanding, how to read them, because, so many of them marked ways of sharing knowledge and sharing information. So these are all things that, traditionally they were practiced, and this is, I think, some of the things we're beginning to see these things, rise again and be revitalized again. And so it's been really good to see those things come again. So all these things, I think, today in a present setting, we're definitely seeing, Indigenous sovereignty regarding our data, that to begin really encouraging our communities to think about that and think about, to take ownership and to really begin moving forward, to collecting their information. So it's a beautiful time to see that, to see how, communities once did those things, and to see today that new things coming forward. So this is for us. We give acknowledgement that for all the technologies we use, that we use them in a good way and in an ethical way. And so these are things that, by listening to, the different things you heard today, that to always keep those things in your mind, but also in your work. And so this is for us when we, talk about truly caring, for our human family, that, it's to ensure that we're well, but also future generations are well. And so this is for us, some of the real important concepts that we describe in our teachings. And so for us, when we talk about health, that we ask the Mishomis and Okamis to surround each of yous with good health and long life and peace of mind, with everyone that's here and those ones that had to leave, or those ones that couldn't be here. But that this also includes your families and your colleagues as well. And so that when you return back home, or you return back to your work, that you can return back with a good mind, and to have that good energy, and so that you feel light and energized again, and that you'll have that ability to focus on the work that you still need to do. So we say Gitchi Miigwech, a big thank you for everyone sharing today, everyone listening today, and that there's been a lot of good thoughts, a lot of good ideas. And so we ask that we'll be able to remember these things in a good way, and carry them in your heart and in your spirit and in your minds, and be able to use these things in a good way for all those future projects and reports that will come. so we say Gitchi Miigwech, a big thank you for spending your time with us, and on behalf of our nation and our people here, that really, really thankful that we can spend this time together. And and this is, I think, really important work for each of us to partake in, because we're all leaders in different ways. And and for us to be a global leader, we also need to make sure that we are communicating with one another and including each other in this work that we have. So we'll say Gitchi Miigwech, a big thank you for spending this day with us, and may you enjoy the rest of your night. And until we see each other again, that all these things will be granted to each of us. So Miigwech, and thank you.